Good evening, everyone, and welcome. Thank you all for joining us here today. My name is Tasneem Al Ibrahim, a fifth year medical student, and I'll be your host for this session. We're very glad to see participants joining us, especially during the end of this holy month. So, we truly appreciate you taking the time to be here today. If you haven't registered your attendance already, be sure to do so that you can get the certificate of attendance. Today's session is part of our ongoing Mastering the Match series, and it focuses on the pathway to surgical residency in Germany. Our speaker today is Dr. Mohammad Chaballout, who will be guiding us through the pathway of surgical training in Germany, from the structure of residency all the way to board certification, focusing on what international applicants can realistically expect. Whether you're still in medical school, recently graduated, or you're already planning your move, this session should help you better understand the pathway and set clear expectations. If you have questions during the talk, please feel free to drop them in the chat box. We'll be addressing them toward the end of the session. Now, it is my great pleasure to introduce our speaker, Dr. Mohammad Chaballout. Dr. Chaballout has extensive experience and insight into the German medical training system, and he has worked closely with international applicants navigating the pathway. Today, he'll be sharing both structured guidance and practical advice based on real-world experience. Dr. Mohammed, thank you for being with us today, and we're really looking forward to your talk. And now, the floor is yours.
Assalamu alaikum, everyone. Thank you so much, Tasneem. Thank you, everyone, for planning and organizing such very nice and helpful session. So, first of all, my name is Mohammad Chaballout. I'm a Faisal graduate, third batch of Faisal University. Currently doing vascular surgery, alhamdulillah. I'll be doing my exam at the end of 2027. So, inshallah. Welcome, everyone. So today I'll be talking. So I'll split my talk into two halves. First half I'll be talking about Germany. Why would someone choose Germany? How to get into the German system? And the other half, like less than half, I will be talking about like how to or during the why Germany. I'll be talking about how to get into the German system, how to ace your interviews, let's say, how to get yourself a position in Germany, and then after that I'll be going into details about surgery specifically and about like details, what to expect, what not to expect from the German system. So first of all, I'll be talking about the structure of the German system, and then I'll be talking about the training or surgical training in Germany. I'll be talking about licensing and licensing pathway, what to expect, what to do, how to perform better than others. After that, we'll understand the requirements and understand the difficulties that we might face here in Germany, and the application process, and then the training, what to expect during the training, what to expect after the training, depending on what's your plan. And then I could go into details, like depending on the question. So first of all, why did I choose Germany? Why would anyone choose Germany? Um, I personally choose Germany for these five reasons. First of all, it's easier for surgical specialties to be accepted in Germany. They have universal healthcare, as everyone knows. They have free education, faster nationality for Syrians like me. Alhamdulillah, inshallah, we don't need it, but we needed that like a couple of years ago. And you get access to all European countries. So for people who like to travel and have fun, it is a very good option for them. So let's talk about the German system. Like, how do we? I'll be talking about the German system in general, and then I'll dive into dive into surgery in Germany. So the German system is a system unlike US and UK. It is a non-centralized system. It depends on the federation, first of all, and then depending on the state that you're in. Um, Depending on the state, in general, you have to get your license by getting something called temporary license, which is going to be 2 years. I'll be talking about that in a couple of slides. And then after that, you get your certification, full certification. Once you get that, you will officially be a resident in Germany. So for surgery, because we are interested in surgery, usually surgery special or surgical specialties are between 60 and 72 months in duration. It is a little bit longer than the others because you get directly or straightforward into your subspecialization. So, for example, I started vascular surgery as a vascular surgeon. We did a couple of rotations, but like it's not like I do general surgery and then you do subspecialization in vascular surgery. This thing has its pros and cons, of course. Pros is that you get exposure to vascular surgery from the beginning. You get to see a lot of cases during these 6 years. Cons is you get into the subspecialization from the beginning. You get hit with vascular reality from the beginning. So mainly, I'll be going through this slide fast. So residents get to go into either visceral surgery, vascular surgery, trauma surgery, or orthopedics, which is very well known in Germany, thoracic and cardiac surgery. There are a lot of other surgeries, but like these are the main subtypes that people join here in Germany. There is, like any other country, university hospitals versus community hospitals. I'll be talking about that later. And then the good thing about Germany is that after you can consider it relatively a good thing that you only need to do one board exam after you finish your 5 or 6 years. And that's a specialty exam or like the board exam. So let's talk about the German system. Getting into the German system, you have to have two things for someone who came from abroad. You have to have something called the Fachsprachprüfung or let's say the German medical skill exam, which is you can compare it to the to step two for the USMLE, where you study a couple of cases and you get for the exam you get one case for 1 hour. You discuss the case briefly with the patient, so they want to see how you take history, how you do your examination, how you can interpret the case, how you can explain it to the patient, and after that, it's a pass or fail examination. Once you pass this exam, you get something called temporary license. So this temporary license allows you to work for up to 2 years in Germany, and during these 2 years, you have to get your recognition. So that's a one good thing about doing your residency in Germany is that you can actually work while preparing for your recognition. You don't have to wait. You don't have to work as TA in Al Faisal or do anything like other thing. You could actually work during these 2 years until you get your let's say final recognition or certification. During these 2 years, you have two pathways depending on the state you're in. A lot of states, or like all states, they would do recognition exam, which is a hard exam. It needs a lot of preparation. It is something like the Fachsprachprüfung, but it's more in details, more medically related, more than language related. Or you can do something called Gleichwertigkeit, or like a recognition of your studies of your university in Germany. If your curriculum matches the German curriculum, then you're allowed to continue without doing this exam. This process is only done in 4 states. One of them is the state that I'm in. Alhamdulillah, I got that. Al Faisal University is widely recognized, or our curriculum is widely recognized in Germany. Me, my wife, my brother, my friends who all applied in this state got it, alhamdulillah. So we don't have to do this big exam, which needs like 6 months of studying. But a lot of my colleagues who studied in Al Faisal chose to just do the exam, get done with it, and not wait for this time. I waited for like 8 months, not 2 years. I waited for like 8 months until I got my certification. After that, you are, let's say, considered a full resident. Before that, you're a service resident. Many states do like they accept you to work. You get paid full payment. You get to do anything except for night shifts because you need to be under supervision. And actually, these 2 years, or if you didn't get your recognition, these years are not count into your residency program. So your residency starts after getting the probation or the probation. So this is like a summary of the steps of going or like coming to Germany. What to do, how to prepare for that. I would suggest that you start by first of all doing your language, because they focus on the language, on communication with the patients way more than during the first exam, the Fachsprachprüfung. They focus on you getting to communicate with the patient way more than your medical skills. Yeah, they focus on them, but like way more on your communication skills, on your language. So if you are planning to continue residence in Germany, I would suggest that you start doing your language right now. To come to Germany, you need a B2, so German language, like every other language, it's A1, A2, B1, B2, and C1. To start your recognition or like to apply for recognition in any states, you need a B2 certification or certificate. And after that, you can either study for the Fachsprachprüfung on yourself, on your own, or do some courses to prepare for it, which is an equivalent for a C1. If you get a medical C1 or medicine C1, that's what you need to enter the medical residency in Germany. So that's let's say a summary of residency in Germany. Next step would be then understanding what is you can jump to the next step. So next one. So no, the one before, please. Yeah. So how to secure a position in Germany? So as we said, there is no central matching system, so you don't have to apply for a center that will like position you in some hospital. Applying to hospitals in Germany, so we're talking about after getting a certificate, applying to, or like before even doing that, residency program is individualized in Germany. It is individualized to you and to your supervisor, let's say. And supervisor is in the hospital, so it is individualized to the hospital itself. So let's say some place has a very good residency program. It will be like there will be a competition on this program. Other smaller programs for people who came from abroad are not that competitive. I'll be talking about that later. So there is no central matching. You get to apply to as many hospitals as you want. There is no time limit. It's not like you apply in September and then you have to wait until next year for you to get a yes or a no. You can apply anytime. Once they have a free position, they will just let you know if your CV matches them. So after finishing the language, after applying for recognition in Germany, you can start applying for hospitals and contacting hospitals to let them know that you're looking for a job. Once you apply to as many hospitals as you can, you hopefully will get a couple of yeses to an interview. A lot of hospitals, like technically all hospitals, have a portal where you could apply for a job or for a residency in their portal. They will get your application. They will invite you to an interview to spend a day or two or three with them, get to know the team. They get to know you too. Um, it is like a give and take situation in Germany. It's not like they test you and they check if you're suitable for them. They check if they're suitable for you too, and they ask you at the end of it if they're suitable for you, if you're happy with them. So it is like let's say a job interview. You apply for them, you go there, you do an interview. You can impress them being uh, by being fluent in German, by showing interest, by showing that you want to learn. And then after that, if they're happy with you, they'll just let you know um, that they want you, or like they might tell you in a week that they want you. Alhamdulillah, my first position, I got the yes on my way back home. So they don't like that is another thing, another good thing in Germany, that they're open about it. They're so straightforward. They'll just let you know if it's a yes or a no. Problem with them is that they're bureaucratic, and sometimes it takes a lot of time to find a position or a vacancy. Um, if you want to master the German system, or like to master the application, you have to have strong German skill. If you have previous surgical experience, a couple of networks, we have a lot of Arab doctors here. This might help you a lot here in Germany. If you show them interest, show them that you're willing to visit them 1 or 2 times, or even 3 times, just to learn from them, they might consider you a very good candidate. So after that, uh, I'm just showing pictures of Germany between them, just to lure you guys into coming to Germany. This is a very old photo. Um, but so after getting into in the program in Germany, so you get into the program, you start your first day. What do you expect? How do you know that you're like the German system is a very well set program, or like a very organized system, or you just follow every step until you finish? For example, I'll just give you an example. Vascular surgery. It is you are allowed to apply for your board exam after 72 months of starting your vascular surgery. But you have something called a logbook in Germany. It is a mandatory document where you collect the cases that you joined in the OR. So they focus mainly on practical skills. They focus on you doing the stuff. So to apply for the exam, you have to have like an okay from your supervisor that you're ready to do the exam. You have to study a lot of books to do the exam, and you have to have your logbook. So let's say for me, I want to apply for vascular surgery exam in like 1.5 year, like approximately 2 years, inshallah. Um, there is a logbook where I log all my ORs that I did. So let's say I did a couple of endovascular. So there are requirements for to apply for the exam. So you have to do like um, lower extremities 100 ORs, 100 endovascular ORs for you to be able to apply for the exam. You have to do a couple of carotid to be able. So there is a logbook for every specialty in Germany. So even internal pediatrics and everyone, but we're talking about surgery here. So you have to have your logbook, you have to have your supervisors, let's say not acceptance, but um, approval to do the exam. The supervisor gets examined by a committee if he's able to, if he's giving you what you really need. So every year there is like a meeting where you sit and you check if you're meeting the criteria for your age, so you could jump for the next year. So there is no exam, but like there is an interview where you see what have I done, what do I still have, what how can I improve for next year. So it is a continuous progress. The more you progress, the more responsibility you get. The more you advance, the more complex the more complex are the ORs that you get, and so your skills grow up with you. So next. So let's take a break before that and take a couple of questions regarding recognition and regarding surgery in Germany.
Okay, I'll read out some questions, but they're mostly
Hmm.
related to examinations. There is one
Yeah.
that's related to surgery. The
Hmm.
question says, is it better to start at a small hospital and avoid university hospitals so that you can get more clinical exposure?
Sure. Yeah. I would suggest that you guys, especially for us who came, like we come from abroad, the German language is not an easy language at all. We are still learning the language until now. So I would suggest that you start in a very small hospital. So you could understand the system first. You could understand how does it work. You can gain experience. You can gain more confidence by doing that. If you went directly to a big university hospital, you will be lost, to be honest. You'll be lost with the system because it is a completely different system. For example, doctors have to draw blood in Germany. That's one example. If a patient came in the ER, we have to do the ultrasound for the patient. So you take your patient from A to Z. So you have to master these skills before you apply for bigger hospitals. So and it is more of big doctors are in big hospitals, but like it is about the name of your supervisor, of who's supervising you, who's teaching you your skills more than the name of the hospital itself, to be honest. But like I suggest, and I would like if you would take my advice and start in a very, very, very small hospital, a rural hospital, so you could get into the system, understand how do they think. Bureaucracy in Germany is a big issue. Unfortunately, we have to live with it. Um, for us who start working here who are non-German, we have to do a lot of writing, a lot of documentation. Um, Discharge notes are not as small as you guys know it. Sometimes it's like 6 or 7 pages. So you have to get into the system before growing up. So and you can just grow up step by step. I started in a very small hospital. The house city was like 13,000 uh, 13, I forgot the English word, uh, person. After that, I moved to a bigger city. Alhamdulillah, I now moved to Hamburg like a year ago, which is a very, very, very big city and a very big hospital, Alhamdulillah. So take it step by step.
Speaking of moving hospitals, one question came in. Is it okay to
Yeah.
start with one hospital and then mid-residency you move to a different one?
Yeah, you could choose. You could also change your specialty. There is no like limit to changing specialty or changing hospitals. If you're not happy with the hospital or with the specialty, you could just change it and move to another specialty. I'll give you an example. I started in psychiatry in Germany because it was easier to get in. It's not very competitive for people who came from abroad. Like the language wasn't that hard like the language was hard, but I wasn't like very strong with the language. So I decided to go into psychiatry because it's not competitive and you get to speak a lot with patients, so you could improve your skills. Alhamdulillah, that worked out for me. A lot of people do rehabilitation too, internal medicine, with all due respect. So until they get more competitive and go to surgery. My
Okay.
wife is an internal medicine, so I get to talk about internal.
طيب, back to surgery. Would you
Yeah,
discuss the process for competitive subspecialties, for example, plastic surgery?
yeah. It is competitive to get into, for example, ENT or plastic surgery in Germany because they provided in big hospitals, like small hospitals, it's not worth it for them to have plastic surgery. So the number of seats are limited. That's number one. Number two, people want to get into it because it is easier and gets them more money at the end. That's reality, to be honest. So it is fairly competitive. There is a pathway in Germany where people do orthopedics. After orthopedics, you do 2 years of hand surgery, for example, if you're interested in hand surgery more than plastic surgery itself. And it is a very common pathway in Germany. A lot of people do it. And it is like a very subspecialized surgery.
These are the current questions that are clinical. The rest are more
Hmm.
language related.
Yeah, we can answer the language related later. So, um, you guys want to talk about more details into surgery, or you want to talk about the recognition? I am open.
We can do both.
Yeah, okay. So let's talk about surgery, first of all, surgery, and then we can go into recognition because it's a very big topic. So, talking about living in Germany, salary in Germany, there's a lot because it is a part of life that we have to take into consideration while choosing our specialty, while choosing the place we want to work, and while choosing the country we want to move to. I'm gonna be talking about the positive things about Germany, why I choose Germany. Uh, because so first of all, regarding salary, during residency, salary in Germany is fairly, very, very well. So there are unions that regulates the salaries. So the hospitals do not play a lot with salaries. So you start by I'm gonna be frank about it. You start with 3,000 euros per month, which is a very good number to be honest, and you could go up to 8,000 uh, during residency. Um, that's one good thing about Germany is the salaries are very good. Doctors are very well paid. Cost of living is fair, to be honest. Um, it- Night shifts are very well compensated. My friends in all other countries, they don't know this, or they don't experience this. But when like there are a lot of regulations and rules in Germany, but night shifts are very well paid. You get a lot of payments after doing night shifts. You get when if you work in during weekends and stuff like that. So it is seriously fairly paid in Germany. Uh, One good thing about it is working hours are strictly controlled. You get to work between 40 and 42 hours. Labor laws in Europe are very strict against the employer, and it's way more with the employee. So you get to work for between 40 to 42 hours per week. Overtime is very well compensated. Sometimes in some hospitals, when if you do like a couple of like a certain amount of overtime, they are or like not some hospital or every hospital, they are mandated to give you a couple of days to rest. You get 35 working days of vacation in Germany. um there are details that I don't want to go into. For example, if you worked in the night, if you had to stay late in the night till like 4 in the morning or 5 in the morning, once you leave the hospital, you're not allowed to enter the hospital until after 11 hours after leaving the hospital. So you are very protected in Germany as a resident or as someone who's working. There is a lot of work-life balance in Germany. They hate just working and getting paid like what we used to do. They have like very good structures. They have a lot of free time, a lot of free hours. So um, it is fairly, let's say, uh, it is fair to work in Germany. For women who work in Germany, pregnancy is protected. If you're working in the medical field, like a doctor or a nurse, uh, you sometimes you get fully paid during your whole pregnancy while staying at home. After giving birth, paternity and maternity leave are split between the mom and the dad for 14 months. So imagine giving birth and staying at home for 14 months and getting paid. That's actually you don't find it any other way. So they motivate you to live there and live your life there and like a very respectful life. So next. So we talked about the good things. Let's talk about the challenges that might face you in Germany. First of all, the language barrier. The most important thing to do to come to Germany is doing the language, and the biggest problem that you will face is the language. Um, it is not an easy language. It requires a lot of effort, a lot of tongue twists. But like it is one of the biggest challenges that you might face. Bureaucracy in Germany. Sometimes they take their time with a lot of stuff. For example, my brother applied for a recognition a year ago, and he still didn't get, and still getting didn't get like a full answer until now. So they take their time with a lot of stuff. There is a big cultural barrier between us and them, like West and East, like everyone. So and as I told you, you have to be realistic with timing because they take their time. So these are the two things that uh, makes me hate working here. Next. One of the good things in Germany is that you get your citizenship fairly easily. Once you work in a highly qualified job like doctors, engineers, pharmacists, and all that stuff, you get something called a blue card. A blue card is, let's say, equivalent to the green card in the US. You once you get it, let's say you're set in Germany, you get to buy a house, you get to do a lot of stuff, everything you want. After spending 21 months or like 2 years in Germany, you get a permanent residency. And after under the newest law, if you work in the or like highly qualified jobs, you get to apply for the citizenship after working 3 years in Germany. So they take their time. I applied for the citizenship like a year ago, like more than a year ago, 14 months ago, and I still didn't get an answer. So yeah, that's living in Germany, unfortunately. One of the things you get to do here in Germany is travel a lot. You get to see a lot of the world. You get to travel to Spain and watch the matches. So, uh, I think this is mainly the introduction about Germany. I will be open to questions now. I know there's a lot of questions, and I had a lot of questions when I was applying. So,
Okay, we'll take them one by one. The
mhm,
first one that we got is what are red flags we should look out for, whether it is in the cities we live in housing, hospitals, or certain medical teams? And then the
mhm,
additional question to that is specifically for females. What is the atmosphere like for trainees who wear the hijab and the niqab?
mhm. Okay, so red flags about the cities. I tend not to like the very big cities. So I hate Berlin, I hate Frankfurt because they're so chaotic. I don't know. It's an opinion thing, but they legalized weed here in Germany. They want to legalize drugs. So in these big cities, you find a lot of that stuff. So personal thing, I hate these big cities because I don't like working there because it's not like you see these people. You have to deal with them. They come to you in the ER. I do vascular surgery. I see a lot of them in Hamburg because they take drugs and like they will come to your hospital. So it's not a red flag. It's a let's say a preference thing. Um, Red flags for teams. There are a couple of teams there are teams that you might see that they're so stressed. They like to stress about a lot of stuff. One thing I faced here, because a lot of hospitals are private hospitals, but the patient don't have to pay. So the hospital will deal with the government, but like the hospital cares about getting a lot of patients, getting a lot of ORs. They want to generate more money more than doing actual medicine. So that's a red flag you might be facing. Um, about hijabis, Kauthar, my wife, wears hijab. She's been working since 2023. Alhamdulillah, she's never faced any problem. People in northern Germany and western Germany tend to be way more friendly than people in the east. That's why you'll see a lot of foreigners, a lot of expats in northern and western Germany and middle Germany, let's say. So just stay away from the east, and you'll be set.
Yeah.
And eastern states are very poor, so you don't want them either way.
Yeah. Okay, the next question, you kind of already answered it, but just so we're clear about it.
Mhm.
You can work in Germany if you have B2, but to get into medicine, you need to reach C1 level.
That was the case when I started, but now most of the states, because Germany like uh, they they are like عرض وطلب at the end. So the states that have a lot of hospitals and so few doctors, they make it sometimes easier for you to start working with B2. Some states that are crowded, for example, Western states, it's not that easy as the others. So theoretically speaking, you can, but the hospital will not accept a person who doesn't have C1, let's say that. So theoretically, on paper, legally, you are allowed to apply for residency when if you have B2, but this Fachsprachprüfung exam is an equivalent to C1. So once you do it, you have a C1, so you can just apply as C1.
The next question is, how long does it take to become fluent in German and get to C1? And how would you prepare for B2 and FSP? What are resources and what's the expected timeline?
Okay, so for first of all, the language depends on your skills. Uh, and uh, and you have to practice the language like every other language. So I finished C1 in Riyadh. Before I came to Germany, I came to a big university hospital in Hamburg, and my first round I understood one word, which is hepatocellular carcinoma. I did not. I thought I came to Denmark or some other country. Because language is about practice. I learned the language until C1 in Goethe Institute. But at the end, language comes with practice. I know a lot of people here who came from Syria, from other countries, who did not know a single word. They had to flee to Germany, and they speak fluent German without any certification. So language is all about it's all about practice. Um, but بعيد عن فلسفة, it takes you about a year. Like to speak the language, but to be fluent, you need a couple of years.
And what is the expected timeline
The
to prepare?
For the Fachsprach, so the language, it took me exactly a year from September to September to finish from A1 to C1. I think Goethe Institute in Riyadh, they make it a lot longer now. And then after applying, depending on your state, depending on your luck, how is your mom praying for you? I think a year from applying until like finding a place is realistic. A year to a year and a half. Alhamdulillah, it took me less than a year to do everything. Um, it took some people up to 2 years to find a position. So it is very variable. It depends on like how the state, the place, the hospital itself. So if you apply only for big hospitals, you just want to work in university hospitals, don't expect to work in 2 to 3 years. If you go to small hospitals, you could work fairly easily. So,
Okay, the next questions will be about the Gleichwertigkeit. So
mhm.
first of all, what are the four states you mentioned that you don't need to apply for the
I- I'm
Gleichwertigkeit?
not I'm not very well updated on the states, but sorry. ماشي خلص نعم شاحن عم استخدم شاحن. Sorry. I thought they were invited, so sorry. The question was about Gleichwertigkeit. Yeah. So the fourth state, I'm not very updated, but it is Schleswig-Holstein, the one I live in, Bremen, Bremerhaven, and the third one was Saxon. But I think now it's only Hamburg. Hamburg joined the group this year. I think Hamburg and Schleswig-Holstein are the best to apply if you want to get Gleichwertigkeit. If you want your papers or like your documents to work fast, I think Bayern is way faster than all the others. If you want to like come to Germany and do the exam. Don't be afraid of the exam. As I told you, I know a lot of people from Al Faisal did the exam and aced it from the first time. So it's not like the end of the world. For me, it was like because I was in Germany to apply to Schleswig-Holstein, you have to be in Germany, not like other states. So for Bayern, you can apply from Saudi Arabia. For Hamburg, you can apply from Saudi Arabia, but like in Schleswig-Holstein, you had to be in Germany to apply for it. So I just used the chance, to be honest.
The next question says that there's a new law starting in October 2026 that makes KP
Hmm.
mandatory for all. So can a Faisal grad still do the
Makes what? Sorry,
the
makes
KP?
what? Yeah, can spoken.
Yeah. Apparently, it has to be mandatory for everyone. So can a Faisal graduates still do the Gleichwertigkeit?
I did not hear about this law. But like 4 years ago, when I started, or five years ago, each state had its own committee that decided if you like it is individualized too, let's say. So I applied my documents. They replied to me with a couple of requirements which I had to do. My wife, I applied for the same state. They sent her another another requirements that she had to do. Even though we study in the same university, we have the same curriculum. My brother is 1 year younger than me. He had other requirements, let's say. So each state had its own committee that decided which requirements you need to do to continue your approbation. Starting from 2024, they centralized that, and all the documents are sent to Bonn. That has a positive and a negative result of it, because the good thing about it is if Al Faisal gets recognized in Bonn, or it is recognized in whole Germany, so you don't have to apply for so you can apply in in every state. Some states like Bayern, for example, or like other state where Frankfurt is, Rhineland-Pfalz, uh, they make you sign a paper that you don't want to do the Gleichwertigkeit. So some states they don't want you to do that. They just want you to do the exam. They tend to be easier to apply to, faster to apply to, but you have to do the exam there. For other states, they accept everything, but as I told you, like the my info is all documents get sent to Bonn, and if Al Faisal gets accepted, we guys have like a template for our curriculum. If you just follow this curriculum, you should be set, inshallah.
Tamam. The next question is, can hospitation be found with B1 and how to find it?
To be honest, let's be realistic. It can be. I'm not saying it's impossible, but it's not that easy, because they want you to deal with patients. They want you to be with patients. In B1, I guarantee you won't understand a word from them. They won't understand a word from you, and they don't want that. They don't want that hassle. They want someone who helps them, who's they're looking for people who would be effective there. So you can apply. I'm not saying I know someone who got hospitation with A1. They told them at the end, no, we don't want you to work with us, but we just accepted you. We wanted you to see the system in Germany. But I guarantee you, they won't take you.
Tamam. The next one, a little bit earlier in the journey, how
Yeah.
important are research and extracurriculars, or is language good enough?
Research is important if you want to apply for a university hospital, like every other country. So if you want to do in a university hospital, they want to like you have to impress them with your research, because they are research oriented. Even if you wanted to work with them, you have to continue doing research with them. They have a couple of hours just for research. So if you want to apply for university hospitals, you get to yeah, it will help you a lot. It helps you in your everyday's life, because a lot of hospitals, like big hospitals, they are interested in research, and if you are interested, they will see a very big potential in you. Kauthar, my wife, got accepted. One of the reasons she got accepted was that she did a lot of research while being in a Faisal in cardiology research, so she gets to do cardiology now.
MashaAllah. Like, the next question is, does overtime fall under the 40 to 42 hour strict rules?
You get to do overtime, but it is compensated. So they have to either compensate you with money or compensate you with time. So every hospital they count your hours and they will at the end like I've it depends on the hospital. They have different models of compensating, but some of them will have you will have like a pool once you like let's say 40 over 40 hours or like 50 hours once you like you exceed that they will have to like compensate you for these 50, so they accumulate every 40 hours and then they will compensate you for them. Some people just accumulate them at the end. But your like every contract is 40 or 30, 42 hours in Germany. There isn't any other contract that's more than that.
There's another question. So
Hmm.
in other countries, for
Hmm.
example, the US, after 3 years of your graduation, there's a decreased likelihood of you matching for residency. So
Hmm.
does this timeline also apply to Germany? As in, after you
At all.
graduate, there has to be a specific number of years?
No, 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 at all. They might ask in the interview, why did you do that? If you can just justify it, but like you don't have, they won't ask you about months gaps like they do in the US. Like you have to fill it with research and prove to them that you did research and you did blah blah blah. No, it doesn't play a very big role. I have residents who are 40, 50 years old who came, like as I told you, who flee to Germany, had to flee to Germany. They don't ask them about that. They just want them to work. I seriously have a resident who's in my year. He has like another year to graduate. He's born in 1981, so they're fair about it.
Alhamdulillah, tamam. Does anyone else have any other questions? If you do, please put them in the chat box. It seems like this wraps it up then for our Q&A. Thank you so much,
Mhm.
Dr. Muhammad, for that insightful and comprehensive overview. Um, there is a couple other questions that just came
Yeah,
in.
sure.
So, do you have any recommendations on prepping for the FSP from like outside courses?
There are a couple of books, a couple of books that prepare you for the FSP. For every state, there's always a WhatsApp group or Telegram group that collect the cases, so you could just study the cases. But studying it is like studying for your professional skills exam in a face. So you study history taking in Germany, you study physical examination in Germany, you study consent in Germany, how to give patient how to take consent from patients, how to explain the disease to patients. So it is technically a professional skills OSCE that Faisal Ikram does. So, or did he stop doing that? I don't know. So, sources are there is a book, I forgot the name, but I have it in my laptop, so I could search for it. There is a book that prepares you for that. There are a couple of books for vocabulary, but as I told you, once you apply for a state, there's always a group for like collecting questions or cases.
Tamam.
Mhm.
The next question, the salaries mentioned earlier were during residency, right? So what
Yeah,
happens after residency? By what percentage would your salary increase?
depending on your specialty, you don't, to be honest, do not expect something like very, 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 very high, like you expect in the US. So it's not that high, but depending on the specialty. So fine specialties, subspecialties, they get paid a fair amount of money. So after like consultants, let's say they get 60,000 reals per month. So that's or an equivalent of 12,000 euros, 11 to 12,000 euros per month. So that's very, very, very fair in Germany.
Okay.
given the fact, to be honest, given the fact that you get free education, free healthcare, you don't have to pay for anything. You get paternity leave, you get a lot of stuff that you don't have to pay for it. I find it fair from my side.
Indeed. طيب, shifting back
Mhm.
to university prep, do you recommend other extracurriculars than research? If so, what are they?
They like volunteering. So if you have a couple of volunteering, for example, I'm not advertising for Smile, but if you join Smile, that would be nice. Uh, um, doing voluntarily work will positively affect your case.
Is there a way for us to know what the requirements for the Gleichwertigkeit are in Hamburg and what documents are required from the university?
They are written in the like in their website. So if you want to apply, they will tell you what to send, what do they want from you. Um, I think it is a fact. We have a curriculum, like a set curriculum that we sent to them and they accepted it. So I think if you guys just followed this curriculum, it would be way easier for you to get it and for the next people so they don't get like multiple versions of Al Faisal curriculums and they would be like hello, which one of you is the right one. So I think if we as Al Faisal students or like graduates um, followed one curriculum, it would be easier for everyone, for us and for everyone.
All right. The final questions both are asking if there's any way that they can contact you for possible questions, such as your
Mhm.
email or phone number, any way you prefer.
You can give them my email or German number or if I don't know if it's possible or feasible if you guys want to do like a WhatsApp community where everyone could post their question whenever they want and I answer them. Sure, I'm way more willing to help. I needed this help when I moved here, when I finished university, and I would be way or like very glad to give this help that I took from the others.
Thank you so much, Dr. Mohammed. I think that
Mm.
wraps it up for the questions now. And I'd really like to thank you once again for sharing your knowledge and your time with us today. And thank you to all the attendees for joining us as part of the Mastering the Match series and for your thoughtful questions. Oops. We truly appreciate your participation, and we hope this session has given you clarity and helped you take a meaningful step forward towards your journey in surgical training in Germany. Please make sure that you registered your attendance if you haven't already, and have a great evening. I wish you good luck and health and safety.
Thank you so much, guys. Thank you for organizing this session. It is very, very helpful. Inshallah, you guys, الله يجزاكم خير يعني بالأخير.
وإياك دكتور.